Positioning a large patient can be challenging. Anywhere the pressure in an area on a body exceeds that of the patient's blood pressure, that area will not be perfused. So you can see how it can be challenging to be sure that you protect the patients who are large. So here are some aids to position these patients to protect them and prevent injury during the procedure. So anesthesia is going to be putting on a wedge on the bed. What this does is it aids with ventilation. It takes off the pressure of the internal organs against the diaphragm and just also makes it easier to ventilate because of the position they're in. And because you have the wedge, they're going to need to put on arm cushions to bring those arms up to the level of the wedge. You just want to be sure when you're putting an arm board on that you do not hyperextend it, that it's less than 90 degrees. If it's over 90 degrees, then the patient is having some pressure on their brachial plexus, and this can cause numbness and permanent damage, nerve damage to their arms, so it has to be less than 90 degrees. They may also be putting a movable air mattress that you see on this that aids in transfer at the end of the procedure, where they blow it up with air and the patient floats on the air mattress, and then you can easily move them over. You're also going to be putting on side extension. We found this worked really well. You put on 2 side extensions and make sure that they're on. It's easier to put them on if you take the cushions off first. So that's what you see in this slide. The cushions have been taken off to aid in the application of these extensions on the side of the bed. Once the side extension is on and secured, then you can put the cushions on, and you can see how much more room this gives the patient. If you didn't have these on, they wanted to use a self-retaining retractor or a camera holder that attaches to the side of the bed, they may not be able to do it. And the nice thing about these side extensions is they do have a side rail on them that you can put one of these self-retaining abdominal or camera holder or liver retractors that attach to the bed. You can do that to the rail just fine. So now you have the patient on the bed, and these large patients tend to have some back problems because of their weight, and their knees tend to be hyperextended when they're on, especially once you put the heels on heel cushions. So you want to put a little roll just above the knee. You don't want to put it directly behind the knee because that popliteal nerve and artery is there, and you could compress that, which you don't want to do. You can also put a footboard on, and we find that you can put it on before the patient even gets in the room. Save yourself that step. We did it even with a 6'3" patient, and it worked well, just having it on ahead of time. And you're not going to be putting them in enough reverse Trendelenburg that the roll behind the knee is going to be an issue. And you're also going to be putting on sequential stockings to compress the calves so that you can maintain the circulation, prevent blood clots in these patients. This is something adapted from spines. When we were doing posterior cervical spines, one of the surgeons, the patient's in prone position, the surgeon would put the arms down at the patient's side and use a sheet that was on the bed to wrap around the patient's torso and secure it. So we use the same principle on these very large patients to help keep their legs in the position that we need them to be. The deciding factor in these patients is, do I need this what I call the papoose wrap on the legs, on the lower legs? Do I need that? Is determined by the size of the patient's thighs. Their calves may not be large, they may or may not be, but if the thighs are large, the legs tend to migrate off the table during the procedure. So you want to secure them, and you could use sleds, but some doctors may want to put a self-retaining here, and we found this works really nicely to put this sheet around, get it in the position you want to secure it. It doesn't interfere with the sequentials. The only thing I would suggest is make sure that you keep that sheet down about 2 inches from the knee and behind the knee. This patient's legs were pretty straight, so it didn't affect it, but if they have an angle to their calf, then there may be some pressure if you put that sheet above it. So just keep it about 2 inches below the knee. So this is how you can safely position a large patient and protect them from injury.